Well, President-elect Donald Trump has big plans for his first 100 days in office. At the top of the list, Obamacare. The GOP has wanted to repeal the Affordable Care Act almost from the day it was signed into law. And now they could have the big question, what will Congress replace it with? And how many people could possibly gain or lose their insurance with what is already being called Trump Care? Let's discuss now with Jonathan Gruber. He's an economics professor at MIT and an architect of Obamacare, and Betsy McCaughey, former lieutenant governor of New York and author of Beating Obamacare. Good morning to both of you.
Good morning.
And so, Jonathan, I want to start with you with the important question. The Affordable Care Act, over 1,000 pages long. How difficult do you expect it will be to repeal this and replace it?
Well, to repeal it politically is not that hard to repeal it. They can do that through the reconciliation process. Replacing it is going to be impossible because the Republicans have shown no appetite for developing a comprehensive replacement plan. They could replace it with something which is, say, half as good. I mean, they could have a plan which, say, covers 10 million instead of 20 million uninsured. But in terms of actually substantively replacing the law, guaranteeing the end of discrimination in insurance markets, and actually covering 20 million Americans, there is simply no plan that's been proposed which realistically achieves those goals. So repeal it, they can do, but then they'll suffer the consequence of recreating discrimination in insurance markets and causing millions of Americans to lose health insurance.
Lieutenant Governor, let me come to you now because Republicans have promised for years that they're going to repeal and replace Obamacare. It's in the first 30 words of any rally for the campaign, we know. Now that they've got the trifecta, both houses of Congress and the White House, the reporting is that they can't decide on what to replace it with. I know you want to talk about some of the points that we heard from Jonathan there, but talk about that. They've had 6 years to come up with a plan.
Actually, they are quite ready. There are two major components in all the Republican plans. They're just working out the fine points. The major one is Medicaid, because 16 million out of the 20 million or so people who have gained coverage since the Affordable Care Act was passed are enrolled in Medicaid. And Medicaid has been around since 1965. It's not going to be eliminated. And the states that have expanded Medicaid eligibility under the law are not going to do a 180 and change that. But the Republicans want to improve the effectiveness of Medicaid spending. It is soaring. It's increasing on a per capita basis at twice the rate of Medicare and is now above $8,000 per recipient. That's several $1,000s more than is being spent on people in private plans. And yet, we see that the people on Medicaid are not experiencing improvement in their health. We want better care for the dollar. And the Republicans all agree that block granting Medicaid to the states so that the decisions are done locally will improve the quality of care delivered to Medicaid recipients. That is the key point in the reform.
Jonathan?
Well, first of all, there is plenty of evidence that Medicaid is quite good for people's health and that people will suffer enormously if it's taken away. Second of all, look, block granting Medicaid is a totally separate issue in the Affordable Care Act. If Republicans want to go ahead and have that debate and say we'd like to block grant Medicaid, that can absolutely be done within the context of the Affordable Care Act. It's a totally separate issue. But Republicans
It isn't a separate issue. It is not a separate issue. It's the biggest part.
Hold on. Jonathan, let me read for you something that Lieutenant Governor McCaughey wrote actually in the New York Post. It's out this morning talking about this law and expanding coverage to millions of Americans. Maybe you've read it. Let's put it up on the screen. Even Gruber's analysis attributes none of the gains to changing the rules regarding pre-existing conditions. Most people with pre-existing conditions already had coverage before Obamacare, and pre-existing conditions crisis was largely concocted to sell Obama's health law. Your response to that?
It's simply incorrect. First of all, what opponents of Obamacare miss is that ending discrimination in insurance markets is not primarily pre-existing conditions. It's about not allowing insurers to charge the sick more than the healthy. And President-elect Trump and others have tried to divert it to make it about pre-existing conditions. That's a small issue. My wife's a breast cancer survivor. If the insurer said, sure, we'll cover your breast cancer, but charge you $100,000 a month, what good does that do her? That is the main issue, and that's the one Republican plans have not addressed. There is no Republican plan which does not allow insurers to charge my wife $100,000 a month.
That's right. But the Republican plans all provide taxpayer-funded subsidies to make care affordable for your wife. The fact is that Obamacare is a scam. It discriminates against young and healthy people, forcing them to pay many times the expected cost of their care in order to subsidize care for the chronically ill. It's unfair to put that whole burden on the small number of young and healthy people in the individual insurance market. And that's why more people refused to sign up, even though they didn't have insurance, than were willing to sign up. And Jonathan Gruber, you know this because on October 17th, 2013, you said for the first of many times, we had to lie about this plan in order to get it passed. If we had admitted that we were going to force the young and healthy to pay in to subsidize the chronically ill, we never would have made it pass. It was a lie. You said it was a lie. And the fact is the Republicans subsidized care for chronically ill people, including, unfortunately, your wife.
Here, Lieutenant Governor.
Honestly, transparently.
Let me jump in here because you said that people aren't signing up for it. We know that in the last several days, several weeks, there have been ramps up of people signing up for the affordable health care. But I want to give you an opportunity to respond to that. And I've got one more thing. Jonathan, quickly.
So basically, what we have is a situation where the law is succeeding, where, once again, there's no answer. Let's go back to what Lieutenant Governor McCaughey, that basically she said, well, my wife, who the insurance companies could easily charge $100,000 a month, don't worry, we'll give her a $5,000 tax credit.
No. What
good does that do?
Untrue.
They do not solve the fundamental problem that was broken in insurance markets, which is that insurers discriminated against the sick. And there is no Republican solution to that problem. None has been posed, and no simple empty talking points will solve that.
We got to wrap it there. Jonathan Gruber, Lieutenant Governor Betsy McCaughey, thank you both for being part of this conversation, which obviously will continue.